So with the ideal care management state continued, we do want to see that our centralized transitional care network in charge of receiving the phone call from our institutions and linking these patients to outside providers for substance use disorder and chronic care are responding within 48 hours after calling them with the need or emailing them with the need. Of course, we're not really emailing unless we're not sharing information that is specific to the patient, but we are definitely calling and making sure that we're following up. Now, in order for that to happen, before we even call the transition care network, we do need logistical information available at 30 days prior to parole in a shared database. It cannot be something that we're waiting to receive, such as in an email. It has to be something that is consistent, is reliable, and it is based on uh, a shared system whereby once a parole agent enters the logistical data, the nurse can feasibly log in, view the information, and enter that into the evaluation. Uh, in order to find out whether or not we need to uh, follow up with several needs for for these patients, we do need to conduct those chart reviews at 45 to 60 days from parole, because this does mitigate when the parole dates are changing excessively based on what I said earlier regarding whether or not they're going to court and those dates are changing, or whether or not they did a reevaluation uh, in the legal system and they determined that um, based on submitted credits that they can actually parole earlier. So we have to keep all of those things in mind. It is a continuously changing timeline for these nurses. So there is a lot of going back and forth um, as they continue to prioritize those that are paroling early with the date changes, but yet keeping track of those patients that are moving from um, the timeline of 45, 30, and 14 days out. Uh, so we'll talk about um, some of the actions that we're taking, some of the improvement activities that are happening to uh, to get us to the ideal care management state. And again, the goal here is to have um, established substance use disorder and chronic care appointments at 95% before the patient leaves the institution.